Very good morning, everybody, and it's a pleasure to be here. Thanks, Alicia, for this invite. Good to see Karan here and the entire Bain team. Always a pleasure. First of all, congratulations to all of you. I understand all of you finally graduated. All right, so good luck and great success in all that you all are pursuing. And I also understand that this is the best of the Aster organization. So again, congratulations to all the bright sparks of Aster over here. When the Bain team came and met me about the entire concept of the Aster Academy, I thought it was a great refresh that this industry was going through. Over the years and with my own little experience over the last 3 decades now, one of the biggest areas of change that this sector needs is probably in the area of professionally driven healthcare delivery systems. Right? All of you have gone through your journey, you've gone through many enterprises, you've gone through a plethora of organizations, and you know that the one which distinguish from the other are predominantly the ones that are very professional in their thought process in terms of not just their growth agenda, but also in terms of people management. And traditionally, this sector has sort of never really learned as much from the managerial competencies and the way that other industries are run. And that is so much of learning to bring into this sector because unfortunately, healthcare has continued to be a little bit more in-looking rather than out-looking. And so all of us are the same group of people who have gone from one organization to the other. And that's not great because at some point in time, you also want to bring in new thought process, new understanding, new horizons, which other industries have gone through and the challenges that they have gone through and how they have come out of it, right? And that's great learning. And hopefully, I think the Health Academy will take you through a lot of that because with Bain's association, with their knowledge of the rest of the world and the rest of the industries and bringing on board much of that learning will be a great value add to the Academy. So I think the biggest issues that we face today on the sector, one. Second, in terms of how do we continuously evolve. Third, how do we look at talent management in the scenario that we are facing today around this sector, but also more a global phenomena, right? People's priorities are beginning to change. And last but not the least, the way that we actually want to grow organizations, particularly like yours, which have a multicultural, multi-geographical presence. And how do you bring in the best of all these worlds together? We live in a little bit of an inconsistent world today. And all of you are aware of it. There are multiple forces at work right now. And the world has never been so unpredictable than what it is right now. And let's start talking about what are these headwinds of change. Number one, the geopolitical position around the world is actually pretty crazy right now. And that is causing in itself a massive amount of change in the way countries are looking at themselves. Countries are looking, again, like everything else, everybody is beginning to look inwards. The forces of globalization, which actually impacted the world for many, many, many years, are currently at threat because everybody is looking inwards. So all of us, for the last almost 2.5, 3 decades, have actually taken advantage of the forces of globalization, which suddenly seem to be changing. Inflation trends, particularly in North America and in Europe, are at an all-time high, right? So there is currently this, inflation is sitting at somewhere in the region of 8.5%, 9%, 8-9%. And that is not going to stay only in one part of the world. While we all believe in Asia that it's probably not going to impact us as much because of the massive growth factors that are sitting in this part of the world, but global currency markets are not going to remain the way they are. And we are going to live in a high interest regime, an era, which effectively means that we're going to see a lot more pressure on costs. We're going to see a lot more pressure on capex. We are going to be seeing a lot more pressure with currency depreciations happening all the time. your consumable cost is going to probably go through the roof in some time. We haven't even started to feel it as yet, right? We are more or less pretty insulated right now because things are, this winter will determine what happens in Europe. Supply chains around the world are completely fragmented. Never in my life of the last so many years have I seen that between the time that you actually place an order for a medical equipment, the first thing that all these companies, Philips, GE, Siemens, will first tell you 6 months of lead time, right? When did you last buy a CT scanner? When one of these suppliers actually told you, guess what? From the time that you give me a PO to the time that the machine actually comes to you, it may take just about 5 or 6 months. It has never happened like that. And this is just one of those medical equipments. The shortage of semiconductors is making, again, a lot of change happen in terms of the way that the world is moving, right? Basically because the entire logistics and the supply chains around semiconductors is changing the supply chain of automobiles, it's changing the supply chain of medical equipment, it is changing the supply chain of computers and electronics and everything that is associated with it. High cost changes. So what do we do when you are faced with a world like this? And I'm sure that many of you have heard about this term called stagflation, right? When you are in a high inflationary environment and you are in a stagnant growth environment, you come to a term called stagflation, which effectively means that you are dealing on both sides of the fence and which is all sounding to a degrowth situation. And so therefore, I think what you are trying to do over here through your health academy is probably at a very, very opportune time in your own history. Because what you take away from here and the changes that you're able to make into your organization will probably create so much of additional value in your own mindset and the way that you deal with all these challenges. So given this macro situation around the world, so when the Brain team first came and met me, I said, I think what's really very important is to start looking at costs as one big lever of change, right? For a very long period of time, and those of us who come from the world of private equity, growth is what we focus on, right? Our entire agenda, and Karan was just, he was just laughing with me and saying that you guys need to probably change your name because when did private equity ever talk about cost control? Private equity only talks about just give me some more growth. Here is more equity and here's more capital, and so let's just fire more growth. But I think there is a time for this reset which has actually come right in front of us. And therefore, at this time, it's important to look at this one lever which is called cost. And sometimes when we all think about cost, we're just following each other's, what each other's efforts are. Now guess what? We all believe that, when we all rise up together to those institutions of excellence, all of us are trying to basically match up to somebody else. But if that one on top is not moving fast enough, that we are all going up in mediocrity. Because somebody's got to make a change out there and become an outlier of influence, and then only you will get some new innovation. But if everybody's moving together to the same goal, you're actually signing up to mediocrity. And that's the difference between what great organizations, good organizations, and average organizations think about themselves. So let's just talk about one, our ability to control revenues. I saw the list of candidates who are sitting over here, and I know that many of you are from the BD sales side. Some of you, belong to on the business development side in different parts of the Aster organization. So revenue is something that probably we are all struggling a bit, right? It's getting more and more hyper-competitive. You start one hospital and lo and behold, within 2 kilometers, you will have another one coming up very, very soon. Lo and behold, another 6 months, somebody gets fired by another private equity fund, and there's going to be another 5 more coming at your way. What do? Your revenue opportunities are getting a little bit limited on the back of this hyper-competitive situation. We all believe that the market has so much to give us, right? Because the market is so large enough that we should never really be thinking of getting into a situation where growth can plateau. But guess what? Why are we then growing at 7, 8, 10%? Why are organizations and why are healthcare organizations growing at that percentage point if the market is so deep and the opportunity is so great. There's something which is happening in the market which is not letting you grow in the mid-teens and the high teens, right? In spite of the fact that the market has so much of depth. So again, coming to the revenue levers, the reason why cost is a major problem is fundamentally because right now, everybody is following the leader. Guess what? And I've done it myself for many years, so I don't, I've done this, right? If your neighborhood hospital follows the same, if you are in the same category, and if your neighborhood hospital in the same category is pricing a procedure at 10,000 rupees, you will always either match that price or underplay that price as a rule, right? Why? Because you'll go to your CEO and say, they are priced at this price point, I have to give it at that price point or even lower. And your CEO will turn around and say, okay, great, just go ahead and do it, right? Why? Because you've just got to match price and just be competitive. Now, guess what? Your input cost as an enterprise may be so dramatically different from that enterprise's input cost. And guess what? If that enterprise had not taken a real world view of their input cost, both of you are actually sitting on reducing margins. And that's what consistently happens in this sector. We all follow the leader, we all follow the price setter, and we all just continue to drag ourselves along with the price setter, not taking enough and more view of where our input costs are. Point number one. Second, the revaluation of costs, and particularly as I told you about the economics and the entire economics of change that are hitting at us, it's so much more relevant right now. The rupee in the last 6 months has continued to depreciate, almost month on month. It doesn't tell you that I will depreciate today and not depreciate another 6 months from now, right? So if you have a certain price point today, which is all based on a certain amount of consumable cost, until unless one fine day your supply chain folks come and tell you, listen, our input cost in consumables has actually, because of the depreciation of the rupee, has actually jumped 15%, and now you need to price this in. Till that time, nobody will even be cognizant of it, because you're still trying to compare yourself to the leader who's not become competent or who has not taken cognizance of that change. So everybody's moving down together. And that's why margins just keep moving down together. So I think the point over here is that what is very important is that when you live in an environment where revenue drivers are limited and revenue has been a big focus, it's important to sort of change our circle of influence and start thinking of costs as a key driver of productivity, profitability, sustainability. Second, take a look at your increasing costs. All of you who are running institutions and are part of running the business, which doctor ever came back and told you, give me less money than last year? Which clinician ever told you, in 6 months' time, that I have an offer from this hospital next door, and guess what? They're giving me 3x of what you are giving me, so I'm going day after tomorrow. It happens all the time, right? And then what do? Okay, doc, here it is, right? Then after 6 months, okay, doc, here's some more. And this journey continues. So, in an environment where your input costs are changing, you also have this massive inflationary cost which is sitting in front of you, which almost as a ticker, and at least in my experience, as a ticker, it starts moving with your revenue. The more and more you begin to do in a particular specialty, the more and more you end up giving to your clinicians in that specialty. So if you start taking a trend line of the last 5 or 6 years, and go specialty by specialty and see the specialties in which you've actually done well, while your margins may have increased a bit, but if you see the amount of change that has happened in your doctor cost over a 3-year, 5-year curve, you will be super, super surprised how much more you have actually ended up paying for the same volume or a little bit extra volume of work. These are hard truths. right? And we all know inside us that these happen to us all the time. We're all living this journey together. We know that that's really the truth in front of us. Let's talk about the next one, which is our staff costs. And I know your HR teams are over here. Your staff costs are jumping 15, 18, 20% year on year. Which nurse ever came and told you, I'm okay to take salary which was there to me, say, even 1 year before? Negotiations and renegotiations on that staffing are actually currently happening by the month, not even by the quarter, right? That staffing is just not available today. So whatever you get, you stay and you want to control it and you want to keep it with you. And so therefore, if you see again the inflationary cost trend of that particular line, it's moving exponentially and moving much, much faster than the revenue growth of the companies. And I see that across the portfolio companies that we have today, right? So, and we run a pretty large book of companies. So it is happening in enterprise after enterprise. Revenue growth, staff cost, fixed cost growth, there is just no connection between the two. So we've got to then become cognizant of what do we do about this. So traditional cost-saving methods are probably not available to all of us anymore. And particularly those of you who run P&Ls, congratulations on graduating again, because this is going to be your greatest year ever. You're going to be so challenged in terms of running a good P&L that it's probably going to be your best learning year ever. Let's come to the macro factors. We spoke about a lot of this. And I think the last but not the least, one of the big other changes that's driving the world right now is that there is less and less free capital, or cheap capital as we called it for a long period of time. The world raised so much of money, and the private equity funds and the venture capital funds raised so much of money over the last couple of years that it was all being thrown around with these technology companies and everything that had anything to talk about tech, right? So I know a very dear real estate friend of mine, and he suddenly changed the name of his company and called it Real Tech. And I said, what's wrong with you? He said, no, I'm in the market to raise some money. If I just put tech along with whatever I do, my valuation goes up another 2 times. So I said, great. And that's truly what it was, that you put tech into anything and you would have tons and tons and millions of dollars being given to you. No more. The winter, as we call it, of funding is right in front of us. And you will see a lot of change happen in the way that capital is now being put behind companies. So there is no more cheap capital around the world, which effectively means that it's a great time for good companies and for companies which are that much thought process oriented in terms of granularity of what they are doing. They'll do a lot more better. So I think we spoke about it. And this is just, these are 4 slides which just talk about the same trends. But I think number 1 to all of you, what is most important is start thinking about your input costs as a conversation point. You may still go by what is most competitive in terms of your thought. But I think what is most important that all of you as teams need to constantly think about your input cost. Incorporate your supply chain teams. Make them become a part of your very integral process around pricing. Look at what are your levers of change in pricing. Look at what are your input change that are happening. Look at how your cost of CapEx is changing. You know, we all believed, and again, I believed for a long period of time, I took CapEx for granted. I would go to my boss and say, okay, you know, this year we need medical CapEx worth $10 million. He would argue, he would tell me things and all that, and we would argue, and then that $10 million will become, say, $7 million, right? That's a negotiation between him and me. And that's where it stopped. Because I just took that CapEx for granted. And that CapEx came in, the interest cost of that was taken care of by the finance team. We priced ourselves the same way, even though it was new technology, but yeah, guess what? I need a 264 slice CT because my neighbor has it. He's pricing it at $5,000. I can't price it more than $5,000. My cost of acquisition of that CT is actually 30% more than his because I'm spending 30% more today. How can I even justify the same price point? how can I justify that same price point? But I did it, and I did it year after year, basically because I had no idea that my CapEx cost is actually jumping so much year on year, basically because it's all dollar denominated. And every time the rupee depreciates, you are basically paying more and more to buying that capital piece of technology. So something to think about in terms of how do you see yourselves as a team? How do you engage? At what levels do you engage? Within what functions do you all engage? And therefore, probably some time to rethink in terms of your collaboration processes as teams themselves. The second one, most importantly, and particularly as you go down to your budget exercise for next year, please start thinking about a zero-based budget, because you will start reading a lot about it in the days to come, and before December gets over, you will probably have tons and tons of articles coming. In fact, I was at a GIC event in Singapore a couple of weeks back, and it was all about that the year 2023 is going to be a very, very different year for all of us around the world. So you will get so much to read about as to why 2023 is going to be a very, very different year compared to all the previous years because of these forces of change. So when you start looking at your budget for FY24, which is, I don't know whether it's you guys take Jan, December, or you take March, April, but whichever year you take it, I think it's very important that you start from zero base. Because if you start putting your percentages of growth on the back of 22 and 21, and start talking about revenue growth and cost growth and everything on the back of that, you're not doing a great exercise. So kindly think about it. Let's go to the next one, because I would also like to leave some time for technology adoption. I think this is an area where I know that Aster as a company has actually done a lot compared to many of the others. But this is an area that is a big focal point right now. And thanks to COVID, it sort of became a great focal point because we all started talking about telemedicine as if that's the greatest thing that changed the earth. And guess what? COVID came and COVID went. Telemedicine came and telemedicine went. How many consults are we doing today compared to what we were doing at the time of COVID? Everybody's sort of gone back to the same way of doing things all over again. So the question, therefore, for us is, what does technology really mean in healthcare today? What are we really investing behind, and why are we really investing behind any kind of technology initiatives? I think, to my mind, and the most important one, and particularly at AHH, which is an enterprise that I run of single specialties, in my head, the EMR potential is actually the greatest push that healthcare organizations can give themselves. And not because of anything else, but basically because there is just so much of data that we all are missing today on the back of these manual registers that we keep everywhere. And in healthcare, there are more manual registers than any other sector that at least I have been seeing, that until and unless you bring it all together, and this data is not just from the context of trying to do good for the world, right? That if I have data, if I have medical data of my patients, I'll treat them well. That's just the starting point. We exist because of that. We don't exist for anything else. We exist for good patient care. And that's a given, right? You need to provide that. But more importantly, I think what it gives you is the opportunity of the so-called lifetime value of the customer. It's all sitting in that EMR. And until and unless you start doing the core analytics around it, you're not really going to be able to get there. And that's where, as I begin to see some of these changes in our own enterprises, before and after, I see productivity sitting there. I see tons of productivity sitting over there. So if you are still in the process and your doctors are still in the process of thinking whether they should have that computer screen in their room and they need to have that keyboard and that somebody else will come and punch stuff for them, I think probably try and accelerate that process a bit, because both those clinicians and those technologies are important to us for our ongoing value creation. Let's go to the third one. And I think uh, productivity. I think this is an area which we again have to think a lot about. This is an industry which has traditionally been super hierarchical, and I make no bones about it. This is an industry which is ingrained from the starting point, which is medical colleges, right? A lot of us, and many of you who would have gone to medical colleges, have gone through that entire process of learning. So you have a lecturer, you have an assistant professor, you have an associate professor, you have a professor, you have a chair of the department, and you have like a ladder, right? And this is because this was how the medical college ecosystem was. That was teaching institutions. And in teaching institutions, you need that layers and layers of staffing to be there. What happened was that much of that same thought process ended up coming into the private side of the business, basically because we felt that some of those models need to be just picked up. Because many of these intermediary layers, the clinicians wanted it for themselves too. And we ended up giving it to them. Because as they came out of these environments and they started coming into the private environments, they wanted the same kind of environment to be given to them in the private setups. So we sort of started to staff their departments like that. And over a period of time, this industry became more and more hierarchical in nature and then function. There is no functional head who actually ever remains solo. By definition, we as human beings are creators like amoeba of everything else around us. So whenever you have one single person and you say, oh, you know, this is my function, and that function will begin to get a life of its own. And that life continues to expand and grow, and more people come into it. And nobody ever turns around and asks, what is the productivity of this team of 10? When you start thinking cost, you actually begin to start thinking your organization structures. Those who are running P&Ls need to start thinking, what am I dealing with over here? And do I need these ecosystems which are as large as I have inherited over a period of time? Something for us to think about. While some of it is a necessity, and that's where you put some technology to work, because that may be looking like a one-time big investment, but ultimately there is a return to that investment, and that should be seen from a cost angle too, and from a people angle too, right? So I think what is important is you're dealing with an inflationary environment. What worked till 2 years back will not work the same way again. The world in the next 5 years is going to be very different. Are you putting the seeds of change, or are you continuing to be status quo? If you are continuing to be status quo, good luck to all of you. So the other one, which is important, is, and those of you who run businesses in India, there is this rising new concept called locums. How many of you deal with them? Right? Okay. You deal with this animal called locums, right? This cost of locums, if you see month on month, quarter on quarter, is actually becoming as large as 100 people of your organization. Have you ever seen the cost factors of this? Those who are in HR will understand from where I'm coming. This is an animal which is rising, right? And it is rising because of what? It is rising because suddenly there is so much of shortage of some talent pools in this sector that we are now literally getting blackmailed to run our organizations on the back of external people coming and helping us continuously, right? Because these external people don't actually want to get employed by you. They want to go and work with 5 other enterprises at the same time. Lately, the information technology enterprises have been debating a lot about this moonlighting stuff. And those of you who have been reading about it must know that literally organizations like Infosys have actually turned around and said, we will allow it. That means a guy sitting at home will be sitting on 3 computers, one that belongs to Wipro, one belongs to Infosys, and the third one belongs to Cognizant, and he will work with 3 enterprises simultaneously. Think back and see whether your locums are doing exactly that to you or no. They are. That is the reality of life. And what we are all facing today is not something which is going to go away, because this is a permanent change to staffing models. And this happened in the US many, many years back. In the US, there are staffing companies. In fact, we at TPG invested a big company there called Medical Solutions. It has been one of our most outstanding exits of 22, because it's the same thing, that in the US, at some point in time, everybody decided, I want to work for 10 hours in a week, right? Doctors, nurses, technicians, everybody went down the same path. While there were a lot of people who began to continue to be on the payrolls of the company, there were a ton of them who came from the outside in and said, I only want to work for so many hours a week. Then there were organizations that got created to sort of handle these companies, or handle this bunch of individuals who wanted to work partial time. And as this trend evolved, enterprises after enterprises and companies after companies began to then turn around and say, instead of dealing with one of these individuals every day, I would rather create an enterprise that would deal with them. So just the same way as we have contractual staffing companies today, that trend is not very far away when you will start having contractual organizations for medical and paramedical staff. And it's all coming. It will come. Because when your locum issues become bigger and bigger, and when every month you're facing a bunch of people who are sitting in front of you and asking you for more money, and you're saying, what am I doing over here? And guess what? When you start playing and paying these people an X amount of money, the people who are employed with you are also asking you for the same. So if a clinician comes or if a registrar comes and does locum duties with you and you pay him $1,000 an hour, your guy turns around and says, why aren't you paying me more? So the cost just keeps moving up a lot more. Something for, again, all of us to think about, that as we move forward, this is going to be a trend that will change the way that medical and paramedical staffing happens in this sector. We spoke about this entire thing, and I think one of the trends that this sector has also created, and many of us did that in Fortis many, many years back, where we created these zonal structures and regional structures, right? And the idea there was that you create these regional structures so that you house people of high caliber talent at the region level. So you have a regional CFO, you have a regional HR person, you have a regional marketing and sales person. So then you don't need to power each one of your hospitals with the same caliber of talent. And so therefore your P&L then at that hospital level begins to sort of be a little lighter, because you can't have this caliber of individual running behind every enterprise, because then your cost just booms. That worked for us pretty well for many, many years. And I think it still sort of works well, because the moment you have these regional structures, and until and unless you just let go of them and you don't really power them well, they can become issues. But otherwise, there has to be a thought process in terms of what level of my talent sits in what part of my org. And once you start to define that, you probably have a much more productive organization. I don't know whether we have enough time. We have crossed time, right? So do we still want to do this? Okay, so I just want to take you through, in a similar kind of a thing, and this is, again, power of private equity at its best in terms of what can happen to organizations when you sort of take some very early stage companies, power them with capital, give them a completely new direction, and make them grow. So this is a company called CTSI, called Cancer Treatment Services International. We at AHH invested behind this company in FY 16-17. This has been a remarkable case study for us in terms of how we took on oncology, and because we all felt that there was a great supply-demand curve on the oncology side, and there was an opportunity to sort of create HCG by de facto had become the only oncology player in this country. And I felt that there was a great opportunity to bring in a second change here in terms of incubating a company which could probably go and deliver oncology in a very differentiated manner. So this is a company that was actually incubated in UPMC in the United States. UPMC is University of Pittsburgh Medical Center, which is one of the largest oncology providers in the world, $6 billion of oncology a year. They had put together this company, which they wanted to do in India by bringing US level protocols in cancer care to this part of the world. Lo and behold, the Americans realized that it is difficult to grow businesses in India. It took them 5 or 6 years to put up one center in Hyderabad, and that took their life out. So then they approached us because one of our partners at TPG sits on the board of UPMC, and we took majority control of this company, which had just this one center in Hyderabad at the time of our investment. There were 3 or 4 key factors that we sort of pushed behind this enterprise very, very quickly. One was in terms of network expansion. And we found that rather than doing everything on our own, there was a great opportunity, particularly in cancer care in the tier 2 cities around this country. And because most of them had not invested behind technology, and they were not very much interested in putting Linux because of the high cost environments of Linux. And we felt that if we were to sort of fund that entire opportunity, bring in our own clinical teams, do almost like standalone towers with enterprises which have other multi-specialties running in parallel, this could potentially be an opportunity of growth. So in FY16, when we actually acquired this company, the revenue of this company was just about 100 odd crores. FY19, when we exited this company, the revenue of this company was 200 and I think almost 300 crores. Yeah, 300 crores. So it's almost like a 40% growth, a 3x increase in revenue. More importantly, when we acquired this company, at 109 crores, this company was making a loss of 16% on EBITDA. At 300 crores, the same company was making a profit of 16% EBITDA margin with all the growth that went in it, with all the capex that went in it, with all the network expansion that happened behind it. And that's fundamentally because, and this is the reason why I was telling you this, that unless you start concentrating on that unit economic improvement, you never really get there. This was this journey, right? In terms of the number of years that was spent behind this company before we came in. And after all the granularity that we gave this company between 2016 and 2019, Varian actually came and acquired this company, and this, in TPG's history, is one of the highest return thresholds that we ever created. We made a 64% IRR on this deal in 3 years' time. $284 million on a $33 million of investment, right? In a specialty which everybody has constantly believed is very difficult to make margins. So the question being and the answer being that when you start taking a look at ecosystems and when you start thinking through in terms of what are the forces of change that you want to build behind enterprises without compromising on their clinical impact ever, there are possibilities of actually creating good shareholder returns, one. More importantly, there are opportunities to create very, very impactful organizations. So in our world, this happens constantly, right? Because this is how we actually grow and make companies happen. So I think this was a company which sort of worked on 3 lines, in terms of the way that we grew this enterprise across people, the joint venture that we did with UPMC, the international tumor boards that we created behind this enterprise, everything that we could put it all together on. We did treatment planning, and actually, this is the world of BPO, right? So we actually took treatment plans from the US, brought them into India, read them by low-cost radiologists in this part of the world, send them back. And that created a massive opportunity for this company to sort of create better margins. So this is it. Questions?
I completely agree with a ton of what you said. 3 questions. One is on the ZBR redesign and ZBB, I completely agree, and we're doing a lot of this in organizations. I'm not seeing healthcare companies adopt this. So I don't know if your experience is different, and if there are benchmark tertiary care hospitals that are actually at the forefront. That was one. Second one is a very unfair question, but just back to the question of CTSI. What are the business model changes that a tertiary care system like Aster should be looking at? Because I agree, because with the current same model that we're trying to push to the next limit, it's going to hit the limit. So I mean, what would you suggest, to Aster and other tertiary chairs? And then third is, Farah and I was just chatting, this whole thing about outsourcing the medical groups. I think it's and looking at contractual makes a lot of sense, but you worry about quality. So how do you solve that?
So in series, Karan. So I think number one, supply chain efficiencies and all that we've been sort of looking at in terms of cost optimization. I think we've all looked at it from the lens of just optimization. But I think, Karan, the way that I see it now, there are some permanent structural changes that are happening. Rupee is not going to strengthen, right? At best, it may become 85. And I know that the teams over here are both in India and Dubai, so likewise. It's not that the cost structures in Dubai are going to change and they're going to come down. They're only rising, right? We are facing the same situation irrespective of the part of the world that we come from. So I think the answer to that, Karan, frankly, and that's the reason why I said that organizations have to now start thinking very deep from ground up. And I'm doing that with a couple of the AHH organizations, and I can see that the amount of inefficiency that over a period of time we keep on layering inside an organization, because we still see a certain amount of EBITDA margin, and we say, it's okay, let it come, let it come. But it doesn't sort of, you never get down to being as granular as saying that if your rupee depreciates another 5, 7, 8%, when are you going to take your next price increase? We've never had those conversations, and I'm sure that even when you do that work, you never ask those questions to these teams, right? That what are you guys thinking? And so this whole correlation between capex changes and pricing, nobody ever talks about it. So I think that is and I think all the multi-specialty hospital chains, all the single specialty hospital chains are all living it the same way. We are all looking at only pricing from a competition point of view. We are looking at cost optimization from what I can do this year, shore it all up, pharmacy, back end, all of that stuff. But I think the real one which is going to come and hit at all of us is consumable cost. And it's already beginning to happen. I think what has happened in the past is that the rate of change or the depreciation of everything together did not impact so much at the same time. What we are facing now is a once in a lifetime kind of a situation, right? Where your capex is going through the roof, your opex is going through the roof, all your fixed costs are going through the roof because your staffing costs are changing dramatically. This requires like a complete reset on just not one part of the cost chain, but all parts of the cost chain. So it's no more about just creating supply chain efficiencies. I think the second one, in terms of where I feel that there is still an opportunity, both for the multi-specialty and the single specialty guys, is basically on just the kind of size and scale that we are creating. Because the same size and scale, so while we are all running 60, 70, 80% occupancies and stuff like that, but the moment you bring it all and start skinning it down, in terms of where is the maximum value getting created out of that massive 80% occupancy rate of institutions, you'll find that it is still, a major portion of this occupancy is probably not giving you that much margin. Your margin is still sort of coming from somewhere at the top, and that margin takes the entire tail along. So it's somewhere to think about in terms of capacity utilization, because in a rising cost structures, what do? If we still want to run 500 bed and 600 bed organizations, probably we can just do one or two of them. And that's truly what is happening, right? I mean, you look at AIG, he's very clear. He doesn't want to do anything else. He doesn't want to grow a second hospital. He's very clear that I want to be just this one hospital in Hyderabad, and I'll just keep on adding more towers to it, rather than, and in fact, I had a massive debate with him because I said, Doc, you've lost one of the biggest opportunities. There is no other GI player in this country. You were the only one. You could have gone with this model all across the country. He said, no, I don't think I can do it. I would rather create 1,500 beds in one, get the best of my cost structures, and guess what? In the city of Hyderabad, he's probably the lowest price point provider today. So it's strange, right? It's very, very strange. And on the other side, you see a quasi-Medanta example where they are the highest price point in the city of Delhi. So there is something which is going on here in terms of capacity and how people are thinking about capacity utilization. And yes, it changes from market to market because no two markets in this country are alike. So I think there was a time when we were all thinking that the whole of India, the whole of GCC is one in terms of you could do anything anywhere and the same pricing would work. What? If you look at all the organizations today, the number of people who are sitting as locums in our organizations is probably already 20% of your staffing. How are you controlling their quality? Nobody has an answer. Because guess what? You're so much in need of this manpower, you don't care. They just come, they do. You know, I was surprised that many of these guys, when they come to work, they also don't want to write on registers in terms of what time they're coming in and what time they want to go out. You start giving them digital footprints and say, stamp on this when you come in, the guy doesn't want to do that. And now they're working as groups. So if one decides to not come to Aster, there'll be 10 other guys who will say, no, you guys have this, you know, I don't want to come and give attendance every day. I'm not interested in coming to your organization. So you're becoming flexible as it is. So I think the question therefore for us is that how do we sort of then formalize this whole structure and therefore then look at quality in a much better way? Because then at least there is a formal structure to your engagement. Today, all these structures are informal. You know, all these talent pools have become informal. And I don't see a time in the future very, very, very early where nurses will come and start doing the same thing. So your ICU nurses will turn around and say, oh, I took the choice of remaining in this country. I didn't fly off to the UK or to the US or to Europe somewhere else. That's basically because I still feel that I need to look after my kids over here. I want to work for only 6 hours in a day or 5 hours a day. But she's a top-class ICU nurse. What do? You will employ her. But if you have a staffing company where there are 25 people who all want to work 5 hours a day, you will probably be in a much better situation. So I think that concept is coming and it is hitting. There are a lot of informal structures which are going on inside our enterprises. We never really talk about them, but the question is that it's all there. And that's the only way to sort of, do this balance of, and quality never needs to get compromised, but I think it's far more compromised in informal structures.
You talked about how private equity used to look at growth, right? And earlier how you used to evaluate companies is basis the TAM and penetration and all that. Now with this funding winter that you're talking about, how does a role of a private equity change first on how they look at investments and with their portfolio companies as well? So what is now going to be the private equity role in such?
So all that I have talked to you just now.
So all this will be
is all that I am living and breathing right now. So in one sentence, this is how, it's not that, we are TPG, right? We have $130 billion of invested capital worldwide. 25 billion of that is in healthcare. So it's not that suddenly all the capital will disappear. But I think there is a time in this, and the horizon of this time is very different than what many of us have felt in the past. And so therefore, from all our collective intelligence perspective, we believe that this is the time when there will be an organizational shift of change that we need to bring about in our portfolio companies.
And what about new investments that you're looking at that will still remain?
Oh, yes, yes. But guess what? The new investments that we are now making, a lot of these questions are also being asked to those portfolio companies.
Fair.
Because margins are not what you see, right? Margins are what will sustain over the next 5-7 years because that's what we are underwriting to. So I may see great margin this year on the back of great COVID stuff which happened last year. But guess what? What's the sustainability of that? And what's the organization doing to remain sustainable with that number?
Yeah.
Yeah, Kalapa.
With running hospitals now with the private equity company, all the I'm sure all the hospital companies are kind of looking at what's my best cost, what's my kind of revenue, what's my EBITDA and PAT, while everybody is squeezing in everywhere just to ensure that they have a better PAT and EBITDA. So is there a threshold to say that what now your material cost has reached this level, you go squeeze in, you're going to kind of compromise the quality, you're going to, your employee cost at this level, you go squeeze in anymore, you will kind of, have an issue with your quality. So is there a threshold to say that, at this point in time, if you're here, if you have to bring it down, obviously you're going to have an issue with your quality, or all the enterprise is going to be pushing, saying that, okay, let's squeeze, as long as I have my numbers, right, probably this will work.
So Kalapa, I think number one, it's not that private equity goes and does this. I think sometimes private equity gets labeled with this black brush that all that they do is go and just start squeezing companies left, right, and center. It's not that. What private equity does to you is they give you capital, but they also tell you to use it efficiently, right? That how are you using my capital is as important to me as your shareholder as everybody else. The question, I think what is more important is not by how you are funded, but what is the organization that you are running and how efficient you want to make your own organization. See, we all use a shoulder of some structure to fire these guns, right? And unfortunately, because I live in the private equity world, I often get these messages that, oh, when every time when a PE comes into an organization, they change everything in that organization. But guess what? If there was no PE in this sector, all of us would not be sitting here. 90% of this sector is actually funded by private equity capital. And every organization has done phenomenally well for itself in terms of their growth trajectory. What is important right now is that it's not just about squeezing cost. It is about permanent structural changes, right? So that permanent structure change, you have to find your own solutions. And it's not just your company which will need to do it. The entire sector has to do it. And I'm so glad that Karan and team are sitting over here because they are also the guiding forces of a lot of these changes. So at the end of the day, every organization will have to go through this change. Otherwise, you will see that company after company over a period of time is going to just start showing growth more from just one or two. And if you begin to see portfolios of some of these organizations, where is the real stuff and real growth coming from? Sometimes if you take a look at their latest cohort of hospitals, that's really what is creating the growth, right? In fact, the number one player in this country is actually going through the same problem. So this is permanent structural change for this sector, irrespective of where we all belong. So we should not think about only around how much we can squeeze costs, but we have to think about not from just the profitability perspective, but can I live this change at all? Or will I just keep on squeezing costs somewhere else while I am absolutely not cognizant of the fact that some of these changes I'll have to price them now? Because what I have not been able to incorporate in my price is finally hurting me.
Hi Vishal. I'm Prothit. We didn't have a chance to get introduced. So I'm a professor of corporate strategy and corporate finance in ISB. And my domain of primary research happens to be private equity. Right, so so this is a
Where should I hide?
very aptly timed session. So just a couple of questions. The first question is more of a comment on something I picked up from what Karan said and what you said. You said a very important theme called structural changes, and Karan touched upon business model changes. Right, so something that really comes up in my contemporary research and with my peers, and I wanted to see if that resonates with you, is the whole concept of bolt-on acquisitions or add-on deals, right? Because now private equity is shifting its focus from financial re-engineering to margin expansion. And one critical thing, Karan, that we are noticing in the industry is mergers of very related assets so that you can get operational value from the synergies between them. So private equity companies are basically serially acquiring companies in a given sector, merging all of them together to develop something of scale.
Absolutely.
So that's one thing I wanted to know if that is here to be sustained and you will see in the future.
Absolutely, because I think that's where the arbitrage is. That's truly
Right.
where the arbitrage sits. And so, and we are now doing it across our portfolio of companies.
Yes.
So, will you go and acquire a company of similar scale, size, and everything? Probably no.
Yeah.
Will you sort of look at it at something smaller and say that how much more uptake can I get out of these margins?
Right.
If I bring my synergies in, that's spot on.
Right, and I think one major implication that might have for the leadership of healthcare providers themselves is actually having kind of an activated M&A function, right? So that you can identify these complementary assets in various geographies and technical niches,
Yeah,
for example.
yeah.
So I was wondering if that is the theme.
No, absolutely.
Yeah.
In fact, I think if you see, and if you see all the action that's happening in the sector, and not just here, but globally, acquisitions is a big theme
Yeah.
around private equity funding, right? Because that's what then powers the next round of the growth of those enterprises. But your best way to doing that is by having the valuation arbitrage or the multiple arbitrage,
Yes.
right? And so when you buy small and sell big, that's really the big arbitrage. But I think the time horizon of that change is now becoming so critical, because earlier you could sit in these companies for a much longer period of time and say, chalo, this year it didn't happen, next year it'll happen. But where the world that we are inheriting now,
Yeah.
there is a need for speed of this change and the agility that comes along with it.
Right. Thanks. And my second question is actually like a pointed question. So healthcare, like many other industries, is at the cusp of disruption of a very new type, right? Which is artificial intelligence, machine learning, a very data-driven approach to both diagnosis and the managerial aspect of it, right? So which essentially means that we are also looking at a kind of a generation of reskilling,
Yeah.
right? Or kind of prioritizing other areas of skills, for example. Now, to get the best skill out there, to be able to perform these very modern technologies and data-driven approaches, we would need a high-quality skill force.
Yeah.
In that sense, in this transition, do you see some inconsistency in that theme versus your focus on costs and cost management?
No, so I think number one, many organizations have tried to do it internally, and which I think will never work. And the reason being that you will never ever get a A team to sort of come in full time into your organization and do a lot of this IT changes or technology reform changes that could actually reform your whole organization. You will never get an A team to come in and do that. And I think, at least I have learned it over a long period of time, and I have miserably failed in it time and time again, that every time when you bring in a new IT head, you believe that, oh, this guy is going to just come and change my world. He never does it. Because it is people who want, it is like us. We love to be in healthcare organizations because we are educated in the world of healthcare, and we live and breathe healthcare. Technology guys want to be in the world of technology. When they come out of the world of technology, they just leave that world behind in a big way. Because now then they are working with their organization, and so therefore their skill sets to some extent get inhibited by the change of their organization itself. The best technology guys work for the best technology companies, period. The best healthcare executives will work for healthcare companies, period. They will not go work for BPO organizations, right? So I think that's the change. We have to encompass the fact that the only way to make a lot of these things happen is look outside in. Because those companies are doing work for 20,000 other enterprises. Probably the cost at which they can give you, obviously not, because technology is always an upward moving curve, but at least you will get things done. Otherwise, nothing gets done. You ask any healthcare institution and organization today, the time horizon of one technology project inside any of these companies.
Yeah.
And then you look outside and you say, how come in the world of startups things just happen so fast in technology? And why does it not happen inside my company? And you will know where the problem lies.
Absolutely. Yeah, and I think one great example of what you just suggested is I taught in the strategy class, one of the case studies was Montefiore Medical Systems in New York, right? So their artificial intelligence and machine learning, the diagnosis, they are partnering with Intel.
Yeah.
So they are not doing it in-house. So it's in a partnership model where Intel is providing all the technology and all. So I think that really resonates with what you said.
Yep. Yeah. Yeah, Alisha.
Thank you. Thank you so much. As always, very insightful coming from you. You know, you spoke about whether structural changes, looking inside, what we need to be shifting, right? And zero-based budgeting. Everyone knows we need to do this. There are some who are able to do it, some who are not. What do you see happening in the institutions that are able to do it? What's the difference? What's changing there, right?
One and only one, Alisha, leadership focus on this area and the leadership drive to make it happen. I think what happens in our layers and layers of organizations that we run, we start conceptually thinking of it at the top, and by the time it sort of goes down to the bottom, it just gets lost. So I think till the time it just does not become a dogmatic focus inside the enterprise, it will never happen. Because everybody has got a reason not to do it.
Yeah, or everyone just tries to push it to the next year.
Yeah,
or
it's,
the
it's
next
all
year.
about the next year,
Yeah.
let this
Yeah,
year pass
that's
by.
otherwise the
There is
thing,
so
right?
much
You're buying
happening
time.
inside our company, so many changes are happening. Why,
Yeah, why do this
unnecessarily
also
create a problem?
as well?
We don't know. This could actually destroy us more than create value.
The best example, I think, of ZBR, ZBB is actually ABI, and is driven by Carlos Brito, the founder, and that's his mantra. I mean, and then they've taken it out and they've made it a religion. So I completely agree, Vishal.
It's
I
all
think-
senior leadership focus and a dogmatic focus, undiluted focus.
But what do you do about, you spoke about pricing and revenue and things like that, just getting very tactical as well, right? So when I look at markets, even in India, so in a Kerala, it's very easy to just do the price increase because, again, it's not insurance-led. When you look at Bangalore, for example, you are not deciding, right? You can say that, okay, my price is higher, maybe my competition is doing lower, but I will increase the price. But that's not an option when you've got an insurance on the other side. So when you're not making that decision, how do you see it playing out as this
So I
penetration
think that's
comes?
unfortunately, Alisha, that's also the reality here now, right? Because unlike the rest of the world, where insurance also makes you innovate around procedures, pricing, gives you tech, all of that stuff, and then gives you a pricing uptake on the back of all of those changes. Here it's all about price, 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 and how much can I undercut you more. I think, and that's why the challenge over here is around this entire change of payer mix, one. It's also a change of specialty mix too, right? And in terms of what do you really want to drive? Where do you still have your margins, right? And you may not get the volumes across the board. And I think that's really where the big challenge sits today. What do you really want to do and why? Right? And we all, in this multi-specialty world, we all continue to live all our specialties basically because we believe now that this is our world. We've got to just carry everything along with us. But the moment you start, even at the pricing that you're getting from the insurance today, there are certain procedures, certain specialties where you do get top tier pricing, right? And there, the opportunity to sort of make higher focus, make higher margins is probably there. But we've got to live this life too. And what happens today with the insurance guys also, right? Nobody is going to them with their cost. Because everybody believes that the moment I start exposing my cost to this guy, he has my full Excel sheet in front of him, and he now knows where I'm making margins, and he'll come and squeeze me even more. So the insurance guys are coming at us without really having any knowledge of your costs. Their knowledge of costs, our pricing is what your neighbors is, right? And so they are looking at everybody with the same lens. So somebody will have to also start having very different conversations with them. And I often talk about the fact, motherhood is a classic example. And that whole company, we had other incumbents in the business. Today, when I look at the margin profile of this company compared to all their others, and those who've been in the business for 10, 15 years, we are producing a very different margin profile. Our four-wall today is sitting at 21, 22% in the same industry, right? Our
Yeah.
post-corporate EBITDA is about 15 odd percent. And this is all happening in 5 years' time. We're sitting in the same hyper-competitive pricing market of TPAs, right? But it's all about the differentiated products that, that the company has put together, which are out of the price regime today.
Good afternoon, sir. Thank you for the insight of having the context of input cost and zero-based budgeting. Thanks for that. I just wanted to ask you one simple question. We're talking about a lot of excellence. Yeah, clinical excellence is something which we cannot avoid. That has to be there. But will service excellence help us get financial excellence, or rather attain financial excellence? That is one question I wanted to ask you. Probably you can help us with that. And we're all talking about cost and cutting price and everything.
We are not talking about cutting price. Huh?
Undercutting.
You guys better learn the new terminology. We are not talking about cutting price.
Yeah. So,
we are basically trying to rethink cost.
Okay. So shall we look at a segment who are like probably have more spending power? Like for example, shall we look at international business, to probably sustain in the industry? Will that be a good idea?
I have a very strong bias around this so-called international business. And Dr. Malti is sitting over here. We tried to, for many years, there was this whole thing that, international is going to be a big play of future growth. Over a period of time, what is really happening? The facilitators are taking away all your margins. You are at best left with a patient who comes from Raipur and gives you a pricing, and if you go and skin that portion of the market, you're making the same margin as you would get out of a patient coming from Africa or from Zimbabwe or wherever. I think this entire misnomer that international, it's just a fly on the wall that people are beginning to make out of this whole thing. Either you become a Bumrun grad and then turn around and say, I will do the best medical tourism in the world and I will get price paid in US dollars without hurting my margins in any way. That is a different vision altogether. What all of us try and do is have some 10 patients come from these weak countries, pay 35% to the facilitators in between, and then say, we are doing medical tourism. Does it make sense? Right? You go and put up your same guys, your sales guys, to go in different parts of the country. If people are crisscrossing countries to get better quality of healthcare, why are they doing it? Because they believe that they're not getting it there. The rich Indians today go to Singapore even today, right? Why? You have the best of the facilities sitting over here, but they still aspire to go there. We run the largest hospital business in Bangladesh. A large portion of their top Bangladeshi patients, and Bangladesh gives you 30% premium over India pricing. And even today, the richest of the Bangladeshi patients go to either Singapore or they go to Bangkok or they go to the US. Why? So there is the same situation within the country itself. There is a patient population which is constantly seeking better quality of healthcare, and they basically believe it is available at an institution which is not in their home state. How are we ever tapping that audience? So chasing African patients, chasing American patients, chasing Australian patients, chasing patients from everywhere, and getting to a head count of 10, I see no reason for it, and I may be absolutely wrong.
Thank you. Vishal, sorry, just one follow-up question from, I'm just taking off a little bit from Professor Purohit's question and Alisha's question. You talked about leadership focus as the one single driver of firms which have been able to implement this. But Vishal, I think, and given again the same experience of the quality of leadership talent also within the organizations, there's an implication on how much time this takes to deliver, and there's an implication on how do you think of investment from the promoter team, from the leadership team, even in terms of bandwidth, in terms of resource allocation. So again, what are best-in-class practices you have seen in terms of how do you even create these teams to deliver on this? One, I think, is focus. One is bandwidth, which is fine. But how do we actually get that done? And in that respect, I was just thinking, saying to some extent, the Aster Academy can be thought of as a vehicle and as an instrument for this. But what are your thoughts on that, Vishal?
So actually, I think the number one thing is that the senior management team, how does it collectively think about many of these initiatives, right? The CEO of the company, the managing director of the company may have one view of the world. What is the view of all the other senior leadership in the room, right, at different functions? How often do they come together to debate this aspect? It all starts from there. In my head, it all starts from there, right? Basically because no matter what you try and push, if all the leadership agenda is not focused in every function, right? It can't just become a supply chains function, as Karan said, that ultimately whom do we look at? Every time when you want margin to be squeezed, where do you go? You go to the supply chain guys. And you say, go squeeze your suppliers. Don't pay them on time. It'll give us another percentage point of EBITDA. But is that the conversation? Or who is sitting with the supply chain folks and talking about the next 2 years, 3 years, 4 years, looking at the last 4 years and see how the changes have happened to all the supply chain initiatives in terms of on the input cost perspective. So I think it's all about what is the agenda with all the senior management folks sitting in one room. And if all of them are on this agenda, there is no reason as to why you will not get results out of it. But it needs to come together. It needs to be bound together. Otherwise, these are budgetary exercises, right? It happens once a year. Every function comes and talks about their 20 initiatives that they're going to take. At the end of the year, they will achieve 5, right? And they will still say that I made so much of impact in my function. That's it. So it becomes a budget allocation. It becomes, in the budget, I have taken these 5 areas. These 5 areas, I will change cost structures to Y. But again, at least in all the work that I have done, I find that the input cost conversation is completely lacking. So the moment you begin to start thinking, and it's a massive revelation, because when you begin to actually see it, it's difficult to even absorb it because it can change organization very differently, right? You may not even be able to put it all into action, but at least one will have a view on it. Yes, Dr. Maldi.
A lot of things has been learned working with you. Phenomenal. I have only one question, and that is to understand how sustainable would an organization be when you tend to bring someone who is an absolute star, work around this person to make the star person extremely happy, and he may not come alone, he may come with a bunch of guys, and then works for you. And you do that because you know this person has done extraordinarily well for the simple reason he's going to get his clientele along with him. My question to you is, how sustainable would such an organization be vis-a-vis trying to make somebody else who's already been there? Efforts have been made but has not risen to that level. So in such a situation, what would be the best option?
So Doc, this is also that whole stuff around getting star clinicians, right? And star clinicians come with their own paraphernalia of their teams, their costs, and you're always susceptible. Because there is enough and more that we have seen in this sector where star clinicians have moved from hospital to hospital, taken away everything, because when you take them, they come with a shadow, they don't want anybody else to grow. So I think it's a call that every organization takes. I, for one, and you know it, have always been against this agenda, right? Because you can, if you start building your organization, which is always so susceptible to your key clinicians all the time, then you are also on the negotiating table all the time.
In which case, is it always better that you motivate and inspire your existing people and allow them every opportunity to grow so they remain loyal to you?
Yeah, so there has to be an organizational push also, right? In terms of, and the time horizon for both are very different. But what is more sustainable in, in terms of the longevity? At least the clinicians who are the second tier clinicians and whose growth you have powered over a period of time, chances are, 8 out of 10 chances are their longevity will be more compared to the guys whom you have just bought out from the market.
Right. And secondly,
Because those who understand that this is how I can keep moving, they just keep doing it.
Absolutely. And I think it also sends a sort of a feeling among the rest of the people that this might be something that they would be exposed to, which creates a bit of an instability.
It's uneasy inside the organization. I mean, there is one organization which has probably done it very well, and that's Medanta.
Yeah.
And that is because of Dr. Trehan himself. And he got all these clinical leaders who've been there for a period of time. But if you see, within that organization too, every department literally runs like a company. And it is run by that stakeholder, which is that clinician. Now, that is not a scalable model.
Absolutely.
And that is the reason why they probably went through an IPO very, very quickly, basically because that's not a scalable model. And if you see whether that's the same thing that they're doing in all the cities where they're going today, you will not see that same thing. So what happened in Gurgaon is probably not going to happen everywhere else. But that is the susceptibility, right? In terms of if one of them goes, that specialty is blank.
Absolutely. Thank you.
Thank you so much. I have Dr. Amit on the line, waiting on the line to ask you a question. Dr. Amit, he's joining us from Dubai.
Hi, can you hear me?
Yes, loud and clear.
I can't hear anything at the other end.
Just a minute, we're just setting it right. Dr. Amit, can you hear us?
Yes, now I can. Thank you. Thank you. Sorry, Vishal, for the time lag. I think you've touched upon, so my name is Dr. Amit. I head the corporate human resources here at Aster. I think through the conversation, very, very, well put, and thank you. You touched upon various points, two of which really touched home. I think one point that you brought about was, how do hospital chains differentiate themselves?
We lost you,
because,
Dr.
you have leadership, you have people just moving around, right? I'm reminded just this morning from PayPal, and now they've moved 45% of online sales, right? Digitally.
Amit, we lost you.
We lost you. Just give us 2 minutes.
So, actually, very fascinating to hear you speak, Vishal. I think it resonates a lot of where we are as an organization and some of the disruption that we're trying to do. You talked about digital, right? And we are in a journey where there was a great amount of resistance, and we still face that. But there's been acceptance, and we're trying to from a cost perspective, you've got core leadership team completely driving that agenda. You've got finance, you've got HR driving that agenda. But there's additional way of leadership. And that's the big change that's happening in daily healthcare. The type of leadership that used to be in hospitals, in business, before business is very different. And there's a lot of similarity in terms of the young generation. You talked about the gig economy as well. The young generation, they want that change. They want that flexibility. They don't want to be doing the rostering. So we're constantly bombarded with those types of requests, and then we've got leadership that's still saying, I need that person, and it's got to be a permanent incumbent. I mean, just in India, we've got a few hundred local employees, and we're talking about quality. So my question to you is that transformation that needs to happen in terms of going to a flat earth structure, right? That's one of the things that you talked about was hierarchy, moving to a flat structure. Because today it's seen as cost cutting. It's not, hey, this is your strategy. You need the right people, capability. I think Dr. Maladi referenced that. Build that capability, but do it with less people and reorganize the organization. So my question to you is just about that leadership change.
Yeah.
What's your view and what are you seeing, I guess, with other healthcare organizations like Aster that are going through this?
So, right in the beginning on the first slide, I said that there is a difference between administering the world of healthcare and coming as managers and administrators versus running the business of healthcare as managers, right? There is a very subtle difference between this whole administration and managerial capability. And I think it is therefore very important, and I'm actually a very, very big proponent of it. We need to get more and more talent from other sectors into healthcare. It is because when they come in with their differentiated thought process and try and drive some of the change as you are recommending and are understanding, you will then see that some portion of the organization moves very differently compared to the others. Either they get subsumed with the entire weight of everybody else, or they will continue to be outliers. But you've got to try that change. And that is exactly what I was telling the Bain team when they first came to meet me, that probably your initiative of the academy must go down that path. Not go down that path of actually saying that, oh, we now want to get everybody from the automobile sector or from the telecom sector, but how do we bring in some of those practices and make this graduating team, push some of those practices harder, right? What do we learn? What do we learn from telecom? What do we learn from FMCG? What do we learn from engineering? What do we learn from technology? How are we trying to bring in those forces of intellect to just come into one organization and practices, and how can some of those practices be reformative? It's a difficult change. This sector is very, very different. So, but it's got to happen.
Great. So,
and I'm sorry for everybody into the room. This is what I am, right? So I talk very openly. I don't mince words. And this is how I think. So sorry if I have hurt any sentiments in this room. But I think the best way to learn is to actually be provocative and not just be nice and goosey and good.
thank you. Thank you so much. Point taken. So we have Dr. Amit's questions. So he was saying that he touched on the point of hospital chains not being able to differentiate themselves because talent typically moves from one to another. Most healthcare group CEOs are from the industry. What should healthcare do to differentiate themselves? And the example that he gave is of PayPal CEO is moving to Nike to move Nike sales digitally.
That's exactly what I said just now.
Cool.
So Dr. Amit is a great visionary.
Okay, he's having a good laugh. So that answers the question.
He didn't say that that's what he would want to do, right? He's an HR head, so he has to keep it nice and neutral. But, there is so much to learn, guys. There is just so much to learn around you. And frankly, the reason why I'm saying that is I have led this life for 30 years. I have gone through multiple healthcare systems. I've worked in 20 different countries. I have seen again and again that the more you remain within your grind, you are never able to see outside of it. There is a great opportunity to sort of see what's happening outside. There is great opportunity to look at other functions of other companies, other enterprises, other people of your same caliber who are coming from other industries, and what are they following. Maybe, forget about everything else. Your own persona changes, your own abilities change, and there is just so much that you can encompass, and which will make you outperform too. Right? Shall we?
I think this is great. Thank you
Thank
so
you very
much.
much.